Many people who suffer from polyneuropathy also suffer from exhaustion and fatigue. Most people are not aware that this is related to the disease, and this is rarely addressed. So if you suffer from polyneuropathy, you will certainly be interested in knowing what causes fatigue and what can be done about it. In this video, I'm going to summarize the recommendations to improve your fatigue that were given in several scientific studies. I will link to those studies in the video description. With a disease as complex as polyneuropathy, there are no simple answers. The disease causes many different problems that can affect fatigue. Therefore, there is not the single cause of fatigue and exhaustion in polyneuropathy, but many that interact. Each patient has different factors contributing to fatigue, and each person needs individually tailored measures to improve the problem. However, there are some factors that frequently occur and that should be taken into consideration most of the times. The first of them are sleeping problems. Since many patients have pain and discomfort due to polyneuropathy, they sleep poorly. In addition, the symptoms often increase or are felt more strongly at night. For example, one of my patients told me that she has been waking up every morning at 4:30 a.m. because her heels started to hurt, even though she did not feel pain there during the rest of the night or during the day. It is obvious that you do not sleep as well if you are in pain. Therefore, if you suffer from exhaustion, it is especially important to get the right painkillers or other treatment for your pain. If your symptoms are worse at night than during the day, it can be useful to take painkillers only before going to bed. I know that there are many people with polyneuropathy for whom painkillers do not work. In such cases, you can ask your doctor if sleeping pills might make sense for you. There are also other methods that can reduce pain besides medication, such as special exercise, stretching, and massages. You can find more information about this on my website bitstertraining.com. The second most important reason for fatigue or tiredness in polyneuropathy is depression. Those who suffer from polyneuropathy sometimes have really good reasons to be sad. However, your mental well-being is a factor that can strongly influence your fatigue and feelings of tiredness. Those who suffer from sadness or even depression often feel additionally exhausted. Pronounced daytime fatigue is even a criteria for the diagnosis of depression. Therefore, if you have symptoms of exhaustion and polyneuropathy, you should also be aware of symptoms of depression and take care of them. Of course, this is easier said than done, as no one likes to be sad and everyone wants to be happy. Therefore, in order to be able to provide helpful information on self-help for depression, I spoke with Dr. Adrian Schweinoch, who is a psychiatrist at a psychiatric clinic in Neuss, Germany. Dr. Schweinoch gave me several tips that may improve depression. He says, and I quote, "It is important not to withdraw too much from social life, especially not for a long period of time, because this can lead to a vicious circle of depression, which means that your mood is negatively affected by being alone, and as a result you withdraw even more. The important thing is to stay active, even if this seems difficult sometimes." According to Dr. Schweinoch, being around other people is crucial. He says, when you're sitting at home by yourself, problems, including the symptoms of polyneuropathy, take up much more space in your life and much more attention than they would if you would try to focus on positive experiences and activities. Furthermore, Dr. Schweinoch stresses the importance of physical activity. He says, lack of exercise can have a significant impact on one's mood and thus can contribute to depression, which is why sports and exercise therapy and also the motivation to exercise regularly play an important role in the treatment of depression. The third important factor for fatigue in polyneuropathy are overstrained muscles. Everyone knows that you feel exhausted after you have done a lot of physical work. It is not so obvious, though, that people with polyneuropathy are often doing hard physical work all the time, often without realizing it. With polyneuropathy, your muscle's strength decreases because the damaged nerves can no longer activate all the muscle fibers as well as they could before. This means that the fewer muscle fibers that can still be activated have to do all the work. So they are doing hard exercise even in everyday life. These muscle fibers become overworked more quickly than those of a person who does not have polyneuropathy, obviously. In addition, your movement patterns change due to the disease. You cannot walk as easily and as efficiently as you could before, and you start using slightly different ways to walk in order to compensate for the problems that are caused by the disease. This can make moving, especially walking, more straining for your body. If I examine the muscles of my patients suffering from polyneuropathy, I often find that they are overworked. This is particularly noticeable because the muscles are tight and shortened, and they hurt if you squeeze them. This is especially common in the lower leg and feet. However, the patients themselves often do not notice this because their perception of these parts of their bodies is impaired due to the polyneuropathy. However, your body does notice the constant strain, and it reports it in the form of exhaustion. This is the reason why those who have stronger muscles suffer less from fatigue. In 2 studies done with polyneuropathy patients by the University of Birmingham and by the University Clinic of Rotterdam, this has also been proven statistically. People with stronger muscles reported less fatigue than people with weaker muscles in those studies. And I will link to those studies under the video. So in order to improve or to prevent fatigue, you should try to take good care of your muscles. There are several things that you can do for them. The first is strengthening the muscles with very targeted exercises, especially for the feet, lower legs, and hands. The second is training your coordination and balance to make your movements more efficient and less energy consuming. You can find exercises for this on my website bitsatraining.com. The third thing you can do for your muscles is actively relax them by massaging and stretching them. Another significant contributor to fatigue, according to scientific studies, is physical inactivity. Those who exercise a lot at a healthy level also report fewer symptoms of fatigue. On the other hand, those who are inactive also suffer more from fatigue. This has been known in sports science for a very long time. In fact, there were already studies decades ago that showed that physical activity can improve chronic fatigue. This has also been investigated for fatigue among those with polyneuropathy. A study at the University Clinic of Rotterdam investigated whether fatigue would improve in patients with chronic inflammatory polyneuropathy if they participated in an exercise program. 20 patients cycled for 45 minutes 3 times per week, and after 12 weeks, they reported 20% less fatigue than before the training period. I will link to the study by Garssen and colleagues in the video description. Of course, it is not as easy for people with polyneuropathy to be physically active as it is for healthy people. I recommend doing activities where you don't have a high risk of falling, such as swimming or cycling on an exercise bike. If you want to read more about this, you can find an article about sports and polyneuropathy on my website, bitsatraining.com. Another cause of fatigue in polyneuropathy are the side effects of medication. Painkillers used by people with polyneuropathy can often cause fatigue and drowsiness. Pregabalin, for example, a very commonly used drug for polyneuropathy, has been reported to cause these symptoms in up to 10% of patients. In addition, interactions between drugs can also cause similar symptoms. For example, one of my patients reported severe problems with fatigue, drowsiness, and dizziness. She also fell repeatedly and injured herself, which made her go to the hospital, where her medication dosage was reduced significantly and her fatigue and dizziness disappeared. So if you suffer from fatigue or dizziness and you are taking a lot of painkillers, you should talk to your doctors about this. With medication, especially painkillers, it is important to check if the negative side effects outweigh the benefits. This is not an easy decision, and it is different for each individual patient. As you can see, there are several things you can do to improve your fatigue. However, there's no one-fits-all remedy that helps all patients in the same way. It is important not to give up and simply accept fatigue as a part of your life though. As you can see, there are several ways to help yourself. However, if you suffer from fatigue and exhaustion, you should also talk to your doctor about it. If you liked this video, feel free to email me and get an individual consultation. I would also be happy if you subscribed to my channel or visited my website bitsatraining.com. Thank you for watching.